All right, Scouts, we're going to go ahead and keep talking about some basic first aid. Tonight, we're going to review a few things first, starting with the 3 C's of first aid. Remember that the 3 C's are check, call, and care. We check first. We always want to make sure that the area is safe for you, then check on the victim. Tap them on the shoulder, say, "Are you okay?" Call for help. This might be calling 911 or sending someone to get help. You might need to shout for help, but whatever you do, get help there. Get professional medical help if necessary. Once you've checked the scene to make sure that it's safe, you've called for help, then you can begin applying first aid. Now, so far, we've talked about a couple of different hurry-up cases of first aid, severe bleeding being one of them. Tonight, we're going to talk about a heart attack and cardiac arrest, which is when your heart stops beating, and also what to do when someone has stopped breathing. These are called hurry-up cases of first aid because, again, they need to be addressed immediately. Someone's life is at stake. If we take too long, they could possibly die, and we certainly don't want that. So first things first, what is a heart attack? A heart attack is when one of your arteries, that's kind of one of the tubes in your heart that blood passes through, becomes blocked. Heart attacks are actually the #1 cause of death in the United States. So it's pretty serious if you come across somebody that you suspect is having a heart attack, that we get them some help immediately. So what are some of the symptoms of a heart attack? So symptoms include pain that's radiating. So radiating means like spreading through the arms, back, neck, or jaw. The victim may have shortness of breath. They could be sweating, even though it might not be hot. They could be generally weak. They could feel nauseous, feeling like they're going to throw up, have sharp chest pain, or be dizzy and lightheaded. Sometimes the symptoms are a little bit different between men and women as well. So even if it only meets 2 or 3 of these, or 3 or 4 of them, it may still be a heart attack. It doesn't necessarily mean that you're going to see all of these, but some of them, and you do need to take them all seriously. Okay? These are all very, very serious, and heart attacks are very serious. So pain radiating through the arms, back, and neck, shortness of breath, sweating even when it's not hot, weakness, nausea, chest pain, and maybe also dizziness or being lightheaded. If a victim has any of these symptoms or multiple of these symptoms, you absolutely want to call for help. Call 911 immediately. Heart attacks are very, very serious. Let's talk a little bit about what you do if you find someone that is unresponsive. Unresponsive means maybe you're hiking on a trail and you come across another hiker that has collapsed on the trail. Maybe they look like they're sleeping, maybe they look like they're injured, but they're unresponsive. They're not saying anything to you. They might look like they're asleep. First thing that you need to do is, again, check to make sure that the scene is safe. Remember the 3 C's? The first one is check to make sure the scene is safe. Then you're going to tap on the victim's shoulder, ask them, are they okay? All right, if they respond to you, their heart is beating and they are breathing. That's a good thing. If they don't respond to you and you're being pretty clear with trying to wake them up and ask them if they're okay, and you still have no response, then we have to start looking at the ABCs of first aid. This is airway, breathing, and circulation. Circulation is just another way of saying blood flow. Is the heart pumping? If the victim is not breathing, or you don't have a pulse, which we'll talk about in just a moment, you absolutely need to call for help, 911, immediately. So the first ABC is airway. You're going to basically tilt their head back. Tilting the head back opens up the airway such that if they're having any trouble breathing or you need to perform rescue breathing, tilting the head back opens up the airway so the maximum flow of air can get into the victim's lungs. You do this by placing your palm on their forehead and their fingers on the chin, and you just gently tilt their head back. If you suspect they have a neck injury, you probably don't want to do this because that could make the injury worse. But if you don't have any reason to believe they have a neck injury, you would tilt the head back and open up the airway. Next, we're going to check the breathing. So we talked about airway, breathing. You place your face near the victims. Can you feel their breath on your cheek? Can you hear them breathing? Can you see their chest rising? If you can feel their breath or you see their chest rising, that means that they are breathing, and that is a very, very good thing, but they're still unresponsive for a reason. If you can't feel them breathing, you can't see their chest rising, or you can't hear them breathing, that means that they may have stopped breathing, and we'll have to do something called rescue breathing, which we'll talk about in just a moment. So we've covered airways, breathing, and now we're going to move on to circulation. Circulation, again, this is the blood flow. You're going to check for a pulse. This can be found on the side of your neck. If you feel the pulse, the heart is beating. If you can't feel the pulse, the heart may have stopped beating. So what you're feeling, if you can feel the pulse in your neck, and you might need to have your mom or dad help you with this, if you can feel the pulse in your neck, that means that your heart is pumping blood. That's a really good thing. If you can't feel that and you check multiple times and you're really trying and there's nothing there, it may very well mean that the victim's heart has stopped beating. So let's take this one at a time. Let's say that you've come across an unresponsive victim. You're checking the ABCs. You've opened up their airway. You've checked their breathing. They are not breathing, but they still have a heartbeat because, yes, you can stop breathing, but still have a heartbeat. So if the breathing isn't restarted quickly, the victim's heart will soon stop. So even if it's beating at the moment, it will quickly stop if the breathing is not restarted. You tilt the head back, you create a seal over the victim's mouth, and you gently blow into their lungs. You ought to be able to watch their lungs rise as you fill it with air, and you're going to do that 2 times. So you're blowing in that air, hopefully watching their chest to make sure that it rises. If it doesn't rise, that means that they might have choked on something. If the air is not going in, they could have something lodged in their esophagus, in which case you would try to take it out and help them breathe. But rescue breathing is if the heart is still beating, but they are not breathing, you would tilt the head back and provide 2 breaths and watch to make sure that the chest is rising as you fill their lungs with air. If they're not breathing or their heart is stopped, we're going to do something called cardiopulmonary resuscitation. This is a way to keep the heart beating until help arrives, and by this I mean an EMT, a doctor, paramedic, something like that. CPR basically helps the heart beat when the body is no longer doing it. You can actually help it by doing something called chest compressions. You would take your hands, you'd fold them over the center of their chest, and you would do 30 compressions, pushing fairly hard in order to beat the heart. After 30 compressions, you would give 2 breaths, and you would continue doing this cycle until help arrives. Again, help is going to be an ambulance, paramedics, EMTs, etc. Every couple of cycles, you're going to check to see if they have a pulse, if they've begun breathing or something like that. If not, you continue it until help arrives or it's unsafe for you to continue. Now, one important thing I do want to put out there for you is that, while we're learning some of this in Scouts, you're not going to try these things on, a parent or a sibling or anything like that. It would actually be dangerous to provide rescue breathing or CPR on someone that doesn't need it. So we're just talking about it tonight. We're going to kind of step through it and watch some videos on it, etc. But I don't actually expect you to do these on anyone. In fact, there are some certifications you can earn when you get just a little bit older from organizations like the American Red Cross or the American Heart Association that can teach you and certify you how to provide this type of first aid in case you ever come across it. So those are 2 hurry up cases. We have rescue breathing when someone has stopped breathing, and also CPR for when the heart has stopped.